All right, thank you so much for sticking with Daybreak, our last interview for today. And today, right now, we want to talk to Mercy Ndegwa. She's the head of public policy in East Africa and the Horn of Africa. Mercy Ndegwa, it's great to have you with us this morning, Mercy. Thank you so much for taking time to talk to us. Allow me to jump straight into this. What is the role of public policy, especially in healthcare, during such a unique time like this? It's not every day we are reporting on a pandemic.
Thank you so much for having me. So public policy is just part of a very huge team at Facebook that is very passionate about the mission of Facebook, which is to give people the power to build community and bring people closer together, which really is what we do with all of our platforms. And when I speak about our platforms, I'm talking about Facebook as a platform, Instagram, WhatsApp, and Messenger. And in regards to this particular COVID-19 pandemic, this is just an extension of what we've already been doing by making sure that even during this time when people are away from their usual physical connectedness, they can still stay connected with their loved ones, stay connected to things that they care about, and so on, online through our platforms. So this is one of the ways. But over and above that, Sorry.
And Mercy, during this past 3 months, when we've been reporting COVID-19 since January, but it really broke out in December, what are you able to read and see as a public policy expert? What has this taught you so far?
Okay, so a couple of things. Number one, obviously people still would love to stay connected and communicate with one another. People are seeking accurate sources of information around COVID-19, and our platforms are a perfect way where this can be achieved. We have made a lot of investment and effort in collaborating with global health organizations such as WHO. We are also collaborating with local government ministries in different countries where cases were getting confirmed, and we're also proactively engaging with government prior to see how we could make sure that they were ready on the platform to be the accurate sources of information around COVID-19. We have also been very busy with trying to train them ahead of time to make sure that they can use the tools that we have on our platforms efficiently for broadcasting messages across to the public and to those that may be worried about the situation, and also for education. So a lot of this is part of the effort that we've been putting in place and is very much leaning on the Facebook mission.
Okay, and here's the thing, Mercy. At the end of the day, being the head of public policy in East Africa and the Horn, are you satisfied with how the Kenyan government and the East African government as a region has handled COVID-19 pandemic?
So governments and global health organizations are the right authorities to be handling this issue. What we are doing as Facebook is making sure that we provide them with an additional channel through which they can articulate the messages that they would like to land with the public, the messages that they would like everybody to know around this issue. And what Facebook has done is to make sure that users are able to identify the government authoritative sources or pages by seeing the check mark that we provided. So we've verified most of the government pages that are involved with this issue of COVID. And this would be the ministries of health, for example. And so you will see that when you go to those specific pages for those ministries of health or WHO and other global health organizations, you can get information from those authoritative sources on this issue. So in regards to that, yes, I would say that there's a lot of effort to put out the right information to educate the public as much as possible as well. And we are supporting all of this by making sure that we waive the costs that these ministries of health or the global health organizations have to incur that would have otherwise incurred in broadcasting these messages to either targeted populations or widely to everybody. So for us, what we've done is to give them the ad credits, what we call ad credits, that allow them to boost content and scale it across to whoever they want to reach, whether it's a small part of the country or the whole country at large.
And Mercy, what critical lessons can we learn as a country so we can sort of strengthen our healthcare system here in the country? What can we do moving forward?
Again, our strength lies largely in making sure that we provide the right platforms for accurate information to get to users. And we think that's a very key part of educating the public on what to do. We have seen a lot of the education campaigns and information being around just educating the public on basics around hygiene and so on. And we are supporting with making sure that those messages that the government and the global health organizations or local ministries of health are providing are then visible and can be accessed very easily by all of those who are users on our platform. So I think that's one way of making sure that everybody gets the right information. And again, with our tools, like I said earlier, we are providing people with an opportunity to stay connected when in a time when people are feeling very, isolated because of being at home while they're working from home or trying to observe social distancing. So we're making sure that people can still connect with people that they love, connect with passions that they have. So people who enjoy to cook up, getting into that. People that enjoy to continue to work out are being able to follow coaches and trainers online on our platforms. We've seen DJs throw entire parties from their own houses and reaching a wide variety of people. And so these are the kinds of things that our platforms are able to do to make sure that during this time, people still continue with some sense of normalcy.
Right. Here's the thing, Mercy. I know that social and economic environment are a big driver to health, especially when it comes to public policy, but more specifically within the health sector. And here in Kenya, during this pandemic time, we've seen Kenyans having to draw from their pockets, especially those Kenyans who have been told to quarantine if they're coming through JKIA. They've had to sort of pull their own funds from their own pockets to quarantine themselves. At the end of the day, cost really does affect our healthcare system. From where you stand, what are some of the factors that contribute to the high cost of healthcare here in the country?
Unfortunately, I would not be the right authority to comment on something like that. I would say that for us, what we're trying to do as much as possible to support the government in ensuring that communication on our platforms is taken care of. They don't have to factor in that cost or worry about it.
Right.
We're trying as much as possible to also collaborate with other partners like mobile network operators and others to make sure that there is some sense of affordability of our services also, which people are trying to access at this time more than probably in the past, and to be able to ease the burden in that way. But I would leave that question to be answered most preferably by the right authorities on this.
Right. Paint for me an image of how public policy influences a nation's health.
I'll mention a couple of things. So number one, the need to have the right information is critical, because then when people know what to do in a pandemic such as this, it's very powerful to have information that is right. And so one of the things we're doing is making sure that we're working very closely with these government authorities that are mandated to share that kind of information to the public, such as the ministries of health, to make sure that they have, they're able to place that kind of information on our platforms and be able to reach all users on our platforms widely. They're doing this through Facebook, they're doing this through Instagram, and you'll see a lot of these institutions now have presence in those places. And we are also supporting with WhatsApp access. So we're doing what we call WhatsApp API access, so that government is able to load, for example, FAQs and answers, so that people can be able to have an experience with such a chat box that is able to answer the questions that they may have of what is COVID-19, what are the symptoms they should watch out for, what are the health centers I should go to if I want to get tested or confirm whether I have any this condition. And such things are part of what we are doing with providing accurate information. But second thing is with regards to misinformation. Facebook has always dealt with the challenge of misinformation, where you have people coming online and sharing information that might deter people from seeking treatment, or maybe present the position of a false cure that is available and that might not be something that has been verified by the WHO, for example, as an authority. We will take measures to remove such content from our platform so that we do not have the prevalence of it, or people being deterred from seeking the right treatment.
Okay.
Secondly, we have, the third thing is also making sure that at all times we are collaborating with these institutions to provide them with updates on what more we can do in terms of support. So previously, before the confirmed cases came, before we had the situation of confirmed cases, for example, in Kenya or even in the rest of Africa where we're doing this, which is in South Africa, Nigeria, Cameroon, Benin, Senegal, Ethiopia, all these countries where we're supporting government, we were initially just providing them with verification of their pages so that they could use their pages to speak to the public. But now we have scaled that up with providing the funds, like I've spoken about, the ad credits, to make sure that they don't have to worry about the cost of putting out information and boosting it across the country at once to everyone that is online. And we know that with Facebook, whilst people are able, not everybody may be on Facebook, a lot of people collect information on our platforms and may share that offline with others. And so because of it, we know that the reach is even wider. And
Okay.
so trying to make sure that that is for governments is critical. But
Right.
particularly addressing misinformation so that we don't have offline harms resulting from information people have picked online.
And Mercy, I hear you. For you, the biggest things that is really coming out from our conversation is the issue of information and really staying connected, especially for Kenyans during this time. But if there's something that has come out is the issue of fake news. How do we as the public see fake news during such a time when information is very critical, but also staying connected in this day and age is quite critical? How do we do that? How do we see fake news as the public?
So thank you for that question. Fake news as well as misinformation is one of the challenges, like I said, we've had for a long period of time because there will be people who come onto the platform and share information. Sometimes they're sharing it with the intention of passing on information to help others, and sometimes the information is not verified or may be harmful if people are trying to take it as the right advice. And so for us, what we're trying to do is we've partnered with what we call third-party fact checkers. And in Kenya, for instance, we have PESA Check, we have Africa Check, and we have AFP and others that we work closely with that are constantly coming to check content that is being put out by people online and finding any information that is erroneous, verifying it with the right sources. And if that is found to be information that is likely to cause harm offline, then that action is escalated to us to take down the content. And where we see that they may not result in harm offline, but is still not information that people should be consuming, we will reduce the visibility on it on our platform so that people don't see that when they don't see it as one of the first things when they get onto their Facebook, for example. In addition, you will see that we are promoting more of the hashtags that are giving right information on the issue of COVID-19. So, for example, you will see more of WHO content. You will see more of Ministry of Health content. And we're doing this across different countries. People have also been started to see and test, even here in Kenya, the WhatsApp API I spoke about earlier, where you can chat with the number 0110-719-719, which is very consistent with the number that people already know as the number to call for queries regarding COVID-19. And with this, you're able to actually also get very quick responses on your phone, whether you have Facebook or not. On WhatsApp, you can get messages, responses to answers, or rather to questions you might have regarding COVID-19. These are some of,
Okay. Thank you, Mercy. That's Mercy Ndegwa. She's the head of public policy in East Africa and the Horn of Africa, just giving us her thoughts on the pandemic, on COVID-19 pandemic, and sharing with us her thoughts on how we as a country can continue to move forward. We need to take a quick break, or rather a cartoon break, for the children at home. Exactly at 9 a.m., Trevor Mbijo will be back with some of the stories making headlines at the top of the hour. Remember, buy yourselves a mask, sanitize, stay home. Staying home doesn't mean that you're isolated. Staying home actually means you are safe. And when it comes to buying masks, try not to buy the N95 masks. Those ones are for the real heroes, our doctors and nurses at the forefront of this COVID-19. Let's take that break. When we come back at 9 a.m., Trevor Mbijo will be giving us the headlines. Right now, here are cartoons for the children.